Hi everyone, and welcome to Therapy Unfiltered. I'm Joe Valder, clinical counselor here, counseling services at Johnson & Wales University. On this show, we take the mystery out of mental health and help you understand what it's really like to sit on the couch. It's time to take a deep breath and dive in. Hello and welcome everyone. Once again, my name is Joe Valder, LMHC, and I'm a clinical counselor over there in counseling services at Johnson & Wales. And this is Therapy Unfiltered. And today is once again, you might notice a theme here, it's a very exciting day at Therapy Unfiltered because we have another very exciting guest. And today I'm happy to say that we have Associate Dean Joe Barresi. And Joe, I was going to say your full title, but I wanted to make sure I didn't mess it up, so I might leave that to you. But welcome, Joe. Good to have you.
Thank you, Joe. Great to be here.
Yeah, so just so we all know, what is the full name there? Because I don't think I got all the letters.
So I serve as Associate Dean of Students, specifically for the areas of counseling, health, and wellness. And the areas that fall under that label are counseling, health, and accessibility related services.
Wow, Joe. Yeah, certainly sounds like a lot of things to cover.
Yeah.
And before we start talking too much more about all those things, just wanted to say, too, why I'm so excited and why I think today's so special is it's the first time on the podcast that we've had two Joes at the same time. It hasn't happened before, and, I'm not sure we'll ever have three Joes, so this could be a big moment.
Happy to make a little recording history here at JWU.
Oh, certainly. Yeah, and so I usually like to start off with just a question about, general things around here in Providence and whatnot, just learn more about you. And as folks know, who are all the regulars to this podcast know, I'm a big food person. So what's your new favorite place here in Providence for food? What's a good favorite restaurant you like?
So I'm usually in the evenings in the Northern Rhode Island area. And my favorite place in Providence had closed some time ago. That was Broadway Bistro. So I did discover a brand new place in Smithfield called Crudo. It's an oyster bar, Italian coastal cuisine.
Wow.
Long title, but most people just call it Crudo, C-R-U-D-O.
Yeah, sounds great. Are you a big oyster and seafood person?
I am, very much, yes.
Oh, same here. We could probably get distracted with seafood conversations.
And crudo in Italian essentially means raw, so I thought it was a very appropriate name for the restaurant.
Yeah, sounds great. Well, very cool, Joe. Thanks for sharing. And I also thought it'd be good because you've had a few different roles here, right, as I understand. Do you want to share a bit about how you first came here and how your role has changed?
Sure. So I have a little bit of history. I am well into my 23rd plus year here. And I was hired actually to do work just like you're doing now. I was one of the counselors originally on the beginning team of counseling services.
Wow.
About 23 and a half years ago. And I can't believe that amount of time has passed us already. Yes. And so from there, I took over some more administrative roles. One included the director of counseling services, and from there, associate dean position that I'm in now.
Wow. Yeah, certainly a lot of history. And I suppose we didn't mention at the intro, but so you're also a social worker, of course.
Yes, yeah. I am.
Yeah,
I have a background in psychology and social work. My clinical licenses are in social work and addictions.
Wow. Yeah, well then very good to have you here. Certainly not the first social worker.
Yeah, certainly not.
Well, great, Joe. And then I thought it'd be helpful too, because you're sort of the first person we've had that's got the connection there to health services. Do you think you could just talk in general about explaining, what health services is here at JWU and how you access it and what it can do for a student?
Sure. So as long as I've worked for the university, we've had a pretty robust health services team. We continue to be currently housed on 2 campuses, Down City and Wales Hall on the 3rd floor. We're typically open there from 9 to 4. And then we have our service at Harborside in the corner of the Hack Building. And that service Monday through Thursday is open from 7 a.m. to 6 p.m. And on Fridays, both clinics are open until 4 p.m.
Okay.
Yeah.
And is that a walk-in type service, Joe, or do you have to call?
Yeah, it's mainly walk-in. There are appointments available, like, for example, for the nurse practitioner. But we very much provide walk-in services for more acute care kinds of needs. Yeah.
Okay. And so, for example, if I'm a student who, I don't know, if I'm feeling a little sick, I have a cough or things like that, or maybe a worst case, I don't know, a fever or something like that, it's a place I can go to get checked out?
Yes, absolutely. We are typically nurse practitioner led. We do have a nurse practitioner on staff right now. And they have full medical authority, including prescription, treatment, ordering of labs, et cetera.
Great. And is that all through insurance as well, Joe, or is that not?
So, no, there's no cost to come to health services. Anything that is ordered in terms of medications or x-rays, so any kind of imaging or lab work, tests, that would have to go through these students' health insurance.
Great. And would that also be a resource, Joe, if a student was looking to find like a regular primary care physician off campus and they were having trouble finding one? Does health services help with that, or is there something else?
They could come in, and certainly we could bridge them to the care that they need. We can help provide some referrals to specialists in the community, et cetera. So overall, sort of general health-related concerns, anyone can come in for a number of reasons.
Yeah.
These days, most people know us because of our immunization health requirements that we're obligated to follow through the state of Rhode Island.
Gotcha. So is that how maybe a lot of our listeners here might be familiar with health
They
services?
may be, because they've probably received lots of emails and messages and calls about any missing documentation.
Gotcha.
Yeah.
Okay, so the best way to I'm guessing those emails include ways to resolve those challenges, right?
Yeah, we can point students in the places where they can become immunized, or explain to them if they're in the middle of a series when the possibility of their next shot is due.
Yeah.
Yeah.
Okay, well, thanks, Joe. And perhaps as a little springboard to talking more about mental health and wellness in general here, is oftentimes, health services and counseling services, we overlap a little bit in terms of, a student might present to health services with, I don't know, maybe chest tightness or like their heart's racing or something like that, and perhaps health services suggest that they come see us in counseling, right? So I suppose what I'm looking to discuss here is just some of the overlap and connection between health and wellness and counseling.
Sure.
Just what your thoughts are there.
So I think, probably going back 30 years now, there's been more of a lens on healthcare that includes mental health. And I think that we've been influenced a lot by more Eastern sort of philosophy and religion in terms of our approach, mind-body approach.
Yeah.
And along with that, I think that at JWU, we try to think more holistically about students' experiences and their needs. And so we tend to take a more holistic approach to their health care, including mental health. One of the things that students can expect when they come into health services is they're typically met by a nurse, a registered nurse, who holds a license in the state of Rhode Island. And the nurses will prep the patient for, beginning assessment questions. We do rule out any issues related to anxiety, depression, gambling, substance use. So we have a number of quick screening tools that we use with students, and that gives us some clues. And of course, the nurses are very kind and compassionate, so students will talk to them about what's going on. And as appropriate, we routinely make referrals to both on-campus counseling services and off-campus counseling. Yeah.
Yeah, well, great. And obviously, like you said, there's a lot of integration and overlap, and I think we're seeing that in the community too, with more integration of mental health into physical health.
Absolutely.
Yeah. And it just makes me think too, I mean, just in general, being sick is sometimes just a stressor, because maybe it results in you missing class or missing lab, which is obviously a big deal, which would then, of course, increase your stress and maybe make you feel anxious and all that sort of thing. So it's all really connected.
Absolutely. And I think we do our best to, be available and accessible to students so that their time out of their classes is very minimal. And the fact that they can get good care on campus is helpful to students, and that way don't have to, run around the state or nearby Providence vicinity to find providers. Of course, if they need a specialty sort of physician or practice, we can help with those referrals.
Gotcha. And I think you said the hours earlier, and I think so, of course, health services is not available on, say, a Saturday, right?
No.
And so then typically what would happen for a student if, I don't know, they were feeling sick on a Saturday and felt they needed to seek support?
Right. They could always call Campus Safety and Security. They're trained to respond, and all of them have specific training related to, the kinds of things that one might expect, right? Like the CPR kind of training and other types of training like that. And they can help students get to where they need to be. For example, if a student is really ill and it's really urgent, obviously Campus Safety can arrange for transport to a more emergent setting like the emergency room.
Great. Yeah, that makes a lot of sense, and I think it's good to know for, because people feel sick any time of the day, any time of the week.
Yeah.
All right. Well, thanks, Joe. And then one last question I had just about health services, I suppose, in general, is that students might be unfamiliar with, is how does it work in terms of, just confidentiality in terms of family and parents and things like that?
Yes. So students are pretty much, treated as adults. If a student is younger than 18 years of age, then their parents do have to sign off for consent to treat their student. Other than that, everything related to health services is confidential. Students can elect to share, their concerns, their health conditions with their parents. And if there's a role for health services to be involved with that communication, that's fine. But it would be at the will of the student.
Yeah, obviously very similar to counseling services then. Yeah, basically the same thing, it would seem.
Yeah.
Cool. Well, thank you, Joe, for all that good info. And like you said, it's both on Harborside and Down City here. So.
Yes.
Yeah. Very good. And then you also mentioned in your role, there's also some initiatives related to wellness or some things happening on campus specific to wellness that you're involved in?
Yes. So for some time now, Student Affairs has been trying to take a more holistic approach in building students' experiences to include not only a culture of care, but to help students be the best you at JWU. That's something that maybe you've heard. And our VP of Student Affairs / Dean of Students, Dr. Melanie Tucker, has really worked to provide some direction for these different initiatives. One of the areas that I am involved with are related to well-being, and I help co-chair a subcommittee of Dr. Tucker's on well-being. And in that committee, we've just actually launched a not only a survey as part of the core committee, but we also are taking an approach with some academic programs around wellness, dimensions of wellness. You probably have seen it. It's usually in the form of a big wheel with different, like about 8 dimensions, everything from physical health to emotional health to spirituality, etc. And so there are some academic programs now, and this will be growing, sort of piloting, engaging students in that assessment and getting some immediate feedback. And where they're a little unbalanced, and some immediate feedback about what students can do to make up for that imbalance.
Yeah, and that sounds really positive. It sounds like there's a good bit of self-reflection there and self-monitoring.
Absolutely.
Students, kind of being aware of yourself. And it seems like that visual is helpful just to kind of keep every piece in mind.
Yeah, and I always feel that whatever we provide to students is a good reminder for those of us who try to affect positive change with students, to also try our best to take good care of ourselves.
Yeah, certainly. And it's a very similar thing we work with in counseling, of course, when we meet with students and we ask general background questions or current functioning questions. And, suddenly a student tells me that typically they're sleeping like 4 hours a night, and then it's like, oh, well, maybe something's going on there.
Yeah.
And I think it's just a matter of, there's all these pieces of our life and all these areas of functioning and whatnot. And like you said, sometimes it's out of balance.
Yeah.
And it's good. I think it's a good approach, obviously, just for overall, awareness and mindfulness.
Absolutely.
Well, everyone, I think that's about enough for today. Join us next time for the rest of the episode.